Tens of thousands of people are diagnosed with HPV-related cancers every year. And according to experts, your best defense in stopping those cancers is by getting vaccinated at a young age. So to explain more about this disease, we're talking with the director of the HPV Cancer Prevention Program at St. Jude's Children's Research Hospital, Heather Brandt. Good morning. Thank you for joining me.
Good morning. Thank you for having me.
So first of all, a lot of people hear HPV and they think of it, as that virus that tends to go away. So how does it really impact the body? How do we know that it is related to cancers that people can be diagnosed with later in life?
HPV is a very, very common virus that almost everyone has at some point in their life. And we know that HPV is linked to 6 types of cancers that affect everyone. The most common HPV cancer is actually oropharyngeal cancer, or cancers that occur at the base of the throat and tonsil area. And it's actually most commonly diagnosed in men, followed by cervical cancer diagnosed in women. And so for many years, we've understood this relationship between HPV and the cancers and precancers and other diseases that it causes. And that's why it's so exciting that now for 18 years, we've had a safe and effective vaccination available and recommended that can prevent 90% of those HPV cancers.
Yeah, and so a lot of people, sometimes people make that argument that like, oh, why can't we treat cancer yet? Or why can't we cure cancer yet? Well, we can prevent it. This is a vaccine that, as you said, now has 18 years of research that proves that it can prevent these types of cancers, but it's still a vaccine that there's some hesitancy to give it to your child, because remind people the age that it's recommended for is an age where people are like, my child is not sexually active and this is a sexually transmitted virus. Tell us a little bit more about that.
Sure. HPV vaccination is routinely recommended for everyone at ages 9 through 12 and through age 26 for those who were not vaccinated at that 9 to 12-year-old age range. And it's for some people between the ages of 27 and 45 who were not vaccinated when they were younger as well. And this is a preventive vaccine. And so we want to make sure that children receive this vaccine before there would be any possible chance that they would be exposed to HPV. And so as a result, that's the rationale for the 9 to 12-year-old on-time HPV vaccination recommendation. In addition, we know that children in this age range have a really strong immunogenic response to the vaccine. This means that the vaccine just really develops the right number and amount of antibodies to offer them long-lasting protection. So it's HPV vaccination at these earlier age ranges to protect them from HPV they may acquire and prevent those HPV cancers that are developed in adulthood.
So I think what you're saying is that if a child gets vaccinated before puberty, it has the chance of training their immune system to better fight HPV later in life.
That's right. It protects them. It provokes an immune response in their bodies that will then, if they are exposed to HPV at some point, their body says, hey, not for me, because I'm protected against HPV, and they will not acquire an HPV infection, and they will not develop an HPV cancer when they're older. And so it's important to focus on that 9 to 12-year-old on-time age group. And now during back to school is the perfect time to do that, as children are heading back to school, or some already starting the school year already. Now is the right time to make sure that kids are protected.
But you did mention that 26, I think you said 26 to 47. So if you miss the window as a child, is it still giving you any good protection if you get the vaccine as an adult?
Sure. So for the 27 to 45-year-old age group, there still is some protection offered. Not everyone is exposed to every type of HPV that's included in the current vaccine. And so there's certainly some protection to be afforded. And long-term studies have shown that it's safe and it's still going to work to protect you against types you haven't been exposed to.
Yeah. And so going back to school, a lot of people are going to be doing some checkups at their pediatrician's office. What should a parent ask their pediatrician about this vaccine and about the process? Is it still a 2-dose shot?
So for children age 9 to 14, it is a 2-dose shot. Currently in the United States, for children and adults 15 to 45, it's 3 doses. And regardless of age, for any children that have a weak immune system, it's going to be 3 doses. But to avoid surprises and last-minute pressure or decision-making about vaccines, we hope parents will take a moment to learn about recommended vaccinations and take advantage of the information that's out there, including from our St. Jude website and other trusted health and medical professionals, so that they're prepared for that opportunity to make a decision to protect their children.
Yeah, and take time to look at the long list of cancers that this can prevent. Heather Brandt, thank you so much for joining us this morning. We appreciate your time.
Thank you.